Welcome back, everybody. Joining us now is David Pavan, Deputy Registrar of the College of Pharmacists of BC, to continue our discussion about cannabis and cannabis for medical purposes. So, David, thank you for joining us again. And we had a great discussion when you joined us for a previous episode. I'm glad you could come back and talk about cannabis today.
Glad to be back here. Thank you, Derek.
So there's a lot of talk about cannabis now in all facets of life, for sure, and pharmacy is no different than that. And I've spoken to lots of pharmacists who seem to want to get involved in medical cannabis in some way, shape, or form. And I think from some perspectives, they see it as an economic opportunity to derive a new revenue stream for the pharmacy. But for some pharmacists out there, I think it really flows from the fact that they're getting a lot more inquiries from the public about getting some help from the pharmacist to make appropriate decisions to get the best possible outcomes from using cannabis as a medical therapy. So let's start with, I guess, the basic question. Does the college have a position, an official position on medical cannabis, and where does the college stand on potentially regulating pharmacy from the perspective of medical cannabis in the future?
Sure. So as you mentioned, our role is to regulate the profession. We're not in the area of improving access or expanding scope of practice. That lands in the government's lap. So from a college perspective, we would regulate medical cannabis if legislation supported it being delivered through community pharmacies. And until that happens, we don't have anything to regulate.
Right.
So currently, the Cannabis Act and the regulations, the way they're laid out now, don't allow community pharmacies to participate in the dispensing of medical cannabis.
And thank you for saying that, because I think that's a little bit of a misconception even right now. And some pharmacists don't know or understand the regulatory regime that we're currently operating under for both recreational and medical cannabis, and are kind of wondering, can I get into this? Can I distribute medical cannabis? And the answer is clearly no, you can't. The regulations don't permit that. So right now, the only way that a member of the public can access cannabis for medical purposes is by getting a medical authorization from a prescriber, and then submitting that to a licensed producer, which is, when we say licensed, we mean licensed by Health Canada. And then having that producer fill the order and ship the product directly to the patient at their home, essentially. Now, I think a lot of pharmacists are attempting to get involved from the perspective of helping facilitate that process. They're not clearly handling the product, but they're helping patients make decisions about which licensed producer to use, which product to get from that producer, which dose of THC or CBD or ratio of THC and CBD they need for their whatever ails them, and based on a lot of other parameters that they might be taken into account. Is there any issue with that process from the college's perspective now, or do you just see that as the pharmacists doing their job in terms of helping patients get the best they can from whatever therapy they choose to use? Is that any different than using another natural health product or an OTC product, or a prescription product for that matter?
And I think that's an accurate statement. We would expect our registrants, pharmacists and pharmacy technicians, to be knowledgeable in all the medications that their patients are taking. And like you mentioned, some of them may not be bought at the pharmacy. They may be from naturopaths or herbal products that they're taking that may not necessarily be purchased at the pharmacy that they frequent. I think one of the concerns probably right now with the way medical cannabis is distributed from a regulatory perspective is it's not on our PharmaNet system. There's a gap there. One may view that gap as a patient safety issue, because unless the patient lets you know they're taking medical cannabis, the pharmacist may not have any idea. And so we're relying on the patients to be open and honest with their pharmacists, and most patients are. But there's still a stigma out there with cannabis and medical cannabis, and there may be patients out there that aren't comfortable sharing that information with their pharmacist. So that does, from a college perspective and a patient safety perspective, highlight a gap that exists. Other provinces don't have the same type of PharmaNet system that we have,
Right.
and I think we're very, very lucky
Fortunate.
and fortunate to have such a great system where you can access a patient's medical history as you dispense their medication and make decisions that are in the best interest of the patient based on that information.
So let's go back to sort of knowledge and training around cannabis for medical purposes, and that sort of angle. From I want to look at that a bit from the perspective of, it's my understanding that the Ontario College has made some sort of training for pharmacists in Ontario mandatory around medical cannabis, and that there's been a few different courses, training courses or education courses developed that they've certified that meet that requirement. And I don't think any other college is doing that. Is BC considering anything like that?
So as far as our approach to that is, we expect our registrants to have the knowledge, skills, and ability to practice in their area of expertise. So if you want to specialize in diabetes, you probably want to get a certified diabetes educator designation.
Right.
If you want to specialize in opioid agonist therapy, you probably want to do some additional training available through the BCCSU or the University of British Columbia. And so as a college and a regulatory body, we or the board has decided, when given direction, I guess, to the college, that that's not really where we're going to go. But we do expect our registrants who decide to practice in areas of specialization that they have the knowledge and skills and ability to do that. Great.
So you want to help somebody out with decisions around cannabis for medical therapy, you should know what you're talking about, or you should not do it.
Exactly.
Yeah.
And if you don't know what you're talking about, and you don't know what you're doing, and a complaint comes forward and it goes through inquiry committee, there obviously will
deal
be
with the
repercussions.
consequences. Yeah. Okay. Well, that's good to know, and I think that really clarifies that issue for us for sure. Is there any move afoot to deal with anything around cannabis education or cannabis regulation from a national perspective through NAPRA? Are you aware of anything from that perspective?
Yeah, I don't think NAPRA's position has changed recently. I think it still is consistent with their initial recommendations. So I do know that it's evolving. Medical cannabis, as you mentioned earlier, is becoming more to the forefront. We're seeing more patients on medical cannabis. So I'm sure that NAPRA is reviewing all of that information and keeping abreast of new developments and changes in that field.
Right.
Obviously I don't sit on that organizational board or have any insight to that, but I would expect them with their role to be on top of.
And just for our audience, I know we use acronyms here when we're having these discussions sometimes, and we haven't said what NAPRA is, but it's the National Association of Pharmacy Regulatory Authorities. So national body that deals with all of the provincial regulatory authorities.
Correct.
I don't know if we've used any other acronyms in this discussion, but we'll try to make sure we clarify for people who are watching, particularly if they're not part of the profession and don't know what that is. One of the things that I've picked up on, and it's just my own sense of things, but maybe it is or isn't true, but I think that there's a lot, because recreational marijuana is now legal in Canada, that the stigma around marijuana use in particular is going away. It's slowly evaporating. But I think one of the things that's happening, and there are a number of reasons for this, is that people who want to use cannabis, and I'm going to interchange marijuana and cannabis as interchangeable terms here, for medical purposes, are not always accessing it through the medical channel. A lot of patients, I think, are wanting to access cannabis for medical purposes, but they're going to the recreational retail outlets to purchase the product. Does the college have any perspective on that, or is that really kind of outside of the purview of the college?
Yeah, that is kind of outside of our purview. Obviously, those operating recreational cannabis stores are not our registrants, and so we don't have jurisdiction over them. I think your statement is accurate. I think there are patients who are using the recreational stream as a way to access cannabis for medical purposes. I think part of that may be the cumbersome requirements of accessing medicinal cannabis and having it, mailed to you through a licensed producer.
Right.
And, again, that's an access issue and one that government needs to address. And I know the federal government is monitoring that as things develop, and whether changes will be made or not, I think is something that the federal government would look at.
So let me put a different spin on this, because you said something about, well, they're, the people who run cannabis retail outlets are not our registrants and so on and so forth. But and true, and I'm not aware of any pharmacists that are retailing cannabis in BC, but in other provinces, and I know in Saskatchewan, the government actually had kind of a lottery system to vet people who were going to want to open cannabis retail outlets through the government process. And there's a pharmacist in Saskatchewan who was awarded 2 outlets. So how would the college, or would the college do anything if a pharmacist in BC actually went through the proper channels and opened up a legitimate licensed retail cannabis outlet?
That's a very interesting question because you're right. If you're licensed and registered with the College of Pharmacists, you are a registrant and you're under our jurisdiction. And as we know, you're a pharmacist, you're always a pharmacist. If you're at a cocktail party and you give advice as a pharmacist to somebody and it's wrong or causes an issue, you will be held accountable.
That's
for that.
why I have a large amount of professional liability insurance.
Yeah. And how that equates to a pharmacist owning a recreational store that sells marijuana. I don't know if I can answer that question.
Fair enough.
I
think it's an interesting one because
and it's probably going to happen. And
it may well happen. I've talked to a few pharmacists who have shown me that they have enough interest in retailing cannabis that it's a possibility that they might do that.
And you know what? But if you're going to buy recreational cannabis and you have a choice between a pharmacist and a non-pharmacist, I probably would go to the pharmacist.
Well, you just hit on one of the reasons that I think they could be successful in that is because they see that they might have a leg up on the 18-year-old bud tender who doesn't really know anything about anything in terms of
physiology, pharmacology.
Yeah, and drug interactions and all of that sort of stuff, and can't really provide any healthcare per se advice to a person who's purchasing cannabis, especially if it's for a medical purpose, right?
So I think there you if you're starting to provide medical advice as a pharmacist, then you would fall under the jurisdiction of the college.
But the retail outlet itself wouldn't fall under the Pharmacy Operations and Drug Scheduling Act.
True. But the registrant would.
That'd be an interesting conundrum if something went haywire.
Yeah.
Okay, well, we'll just keep an eye on that one for future. And if we get to a point where we know of a pharmacist that's doing that, we might want to
call you back
and them at the same time as well.
That'll be an interesting discussion.
Indeed, I think indeed it would.
Yeah.
So, I guess at this point, to sort of sum it up, if I'm understanding everything you've said and appreciate the clarity that you provided, there's no reason for the college to, there's nothing to regulate at this point in time until such time as there might be changes to either the act and or regulations that allowed pharmacists to physically handle the product. There's really no role for the college from a regulatory perspective. And it's just an expectation that, like with any product or advice that you're providing to patient, that you practice within your own level of knowledge, skills, and abilities.
Yes.
Is that
a
good summary of it?
Yeah, for sure.
Well, again, thank you very much. We appreciate you taking the time to come and talk to us about this topic today. And you're a wealth of information, so we look forward to having you back again as another guest to talk about other future topics that might be of interest to our members from the college perspective, the registrants and members of the public that might be watching. So thanks again, David.
Thank you, Derek.
That wraps up this episode. We look forward to seeing you again when you join us again for our next episode of Pharmacy in Flux.